Hello, friends, and welcome back to another episode of the Juicebox Podcast. Jenny's back, and we're going to do another Defining Diabetes episode today. So buckle up, and we'll define PCOS. Nothing you hear on the Juicebox Podcast should be considered advice, medical or otherwise. Always consult a physician before making any changes to your healthcare plan. A diabetes diagnosis comes with a lot of new terms, and you're not going to understand most of them. That's why we made Defining Diabetes. Go to juiceboxpodcast.com, up into the menu, and click on Defining Diabetes to find the series that will tell you what all of those words mean. Short, fun, and informative, that's Defining Diabetes. Don't forget to save 40% off of your entire order at CozyEarth.com. All you have to do is use the offer code JUICEBOX at checkout. That's JUICEBOX at checkout to save 40% at CozyEarth.com. If you're a U.S. resident who has type 1 or is the caregiver of someone with type 1, you can, right from your couch, right from your phone, you can add your help to type 1 diabetes research by completing the survey at t1dexchange.org/juicebox. This show is sponsored today by the glucagon that my daughter carries, Gvoke HypoPen. Find out more at gvokeglucagon.com/juicebox. This episode of the Juicebox Podcast is sponsored by Eversense. The Eversense CGM is more convenient, requiring only one sensor every 6 months. It offers more flexibility with its easy on, easy off smart transmitter, and allows you to take a break when needed. EversenseCGM.com/juicebox. I'd like to define PCOS.
Oh.
For the kids.
Yeah.
Yeah? You excited?
Okay. Yeah. I do a lot in women's health. And as you know, I've said many times before, a lot of women in that sort of time of life where they may very well be considering kids. So I'm surprised we didn't talk about PCOS before, but maybe we haven't.
I just don't think we've specifically given it its own defining diabetes. Now, wait, let me make sure we haven't. Hold on a second. That's a good point. Maybe Scott just isn't good at keeping his list up. Give me 1 second.
Well, the list is pretty long. I don't even know how long the defining is. We did quite a number of things.
Oh, it's over 50 at this point.
Okay.
But you just said something that just really made me think, let me just double check, because that's pretty smart, because we could pivot to another one if I'm wrong about this, and that people will just get to laugh. Hold on a second. Nope, we haven't.
Yay.
Good job. But I didn't know, honestly.
Something new to talk about. Although it's not new by any means.
No. Is it something that many women might be suffering with and their doctors never even give a name or a voice to it? They just treat them like, oh, you have tough periods or something like that?
I would say I see that more and more, especially since in the years of having diabetes myself. I think it's really just been the past 10-ish years that I've heard more about PCOS.
Mm-hmm.
And especially just the past couple of years alone, more women who've actually had a more proper diagnosis of PCOS from providers who help them look further into some of the issues that they've had for a long time, maybe since they were a teenager or a young adult, and I think I get to see it, especially, as I said, because some people end up trying to conceive. And at that point, further testing, especially if you move into more fertility management,
mm-hmm.
there are a lot more tests that end up being done just because you are going to a specialist who should be evaluating all these things.
Yeah.
Hormone levels, PCOS is, do you know what the acronym is, right?
Actually, I know this one without looking. I know it's polycystic ovarian syndrome.
Yeah, polycystic ovarian or ovary syndrome.
Ovary syndrome.
Yes.
Okay.
So we know that it would affect hormones, right? Mainly because ovaries are the big thing that's impacted here, and they produce a lot of hormones in a woman's body. I mean, they're the little places that all the eggs that a woman has are kind of packed into.
Yeah. I think of it as an egg purse.
Yes, there you go.
Thank you.
An egg bank.
I also don't know why I think of it as anything, but that is how it pops up in my head. I have here PCOS is a common hormonal disorder that affects women of reproductive age. It is characterized by a combination of symptoms and physical findings that include irregular menstrual periods, excess androgen levels, polycystic ovaries. So
a lot of the times it's because the hormones, they're not regulated the right way in order for ovulation to happen on a monthly cycle or that 28 to 32 day kind of normal cycle that we call normal, right? When somebody doesn't ovulate, essentially, you get these cysts. So that's where the polycystic, many cysts, right? That's what the word means, comes from. These little like cysts that kind of pack around the ovaries. And you can actually, in the right type of testing, in the right time of the month, you could actually see more of those sacs or cysts at certain times. So evaluation is really, really valuable. I think the other piece to proper diagnosis is talking to a woman who has symptoms that sound like it might be PCOS. But the other unfortunate thing is that PCOS is commonly thought to kind of also go along with a particular body type, being more overweight, obese, already having issues with different metabolic kind of systems, high cholesterol levels, blood sugar levels that are unmanaged. Insulin resistance is a hallmark of PCOS, kind of similar in type 2 diabetes, right? So when you talk about type 1 diabetes, I've had a number of women who, by visually looking and diagnosis of type 1, would never have been thought that they could possibly have PCOS, and they do.
Yeah. I think Arden has it, and she doesn't fit the stereotype. It's tough because, years ago when they're trying to figure things out, we don't really understand as much as we do. You start saying, oh, well, a lot of these ladies look like this, so it must be you're having this problem because instead of saying maybe my body style is like this because of the PCOS or other factors,
right.
They kind of put the cart before the horse. I want to read this.
Please.
PCOS can also lead to long-term health problems such as type 2 diabetes, heart disease, and issues with fertility. The exact cause of PCOS is unknown, but factors like insulin resistance, inflammation, and genetics are believed to play a role. Treatment typically focuses on managing individual symptoms. This is the problem, and may include lifestyle changes, medication, and hormonal therapy. The problem is that we manage PCOS with Advil. Do you know what I mean? Like, you're having a painful period.
Right.
I think the reason that you're hearing more about it now in the zeitgeist again is because of the impact that GLP medications are starting to have for people. If you take insulin or sulfonylureas, you are at risk for your blood sugar going too low. You need a safety net when it matters most. Be ready with Gvoke HypoPen. My daughter carries Gvoke HypoPen everywhere she goes because it's a ready-to-use rescue pen for treating very low blood sugar in people with diabetes ages 2 and above that I trust. Low blood sugar emergencies can happen unexpectedly, and they demand quick action. Luckily, Gvoke HypoPen can be administered in 2 simple steps, even by yourself in certain situations. Show those around you where you store Gvoke HypoPen and how to use it. They need to know how to use Gvoke HypoPen before an emergency situation happens. Learn more about why Gvoke HypoPen is in Arden's Diabetes Toolkit at gvokeglucagon.com/juicebox. Gvoke shouldn't be used if you have a tumor in the gland on the top of your kidneys called a pheochromocytoma, or if you have a tumor in your pancreas called an insulinoma. Visit gvokeglucagon.com/risk for safety information. How many times have you thought, it's time to change my CGM? I just changed it. And then you look and realize, my God, it's been 14 days already, a week and a half. Feels like I just did this. Well, you'll never feel like that with the Eversense CGM, because Eversense is the only long-term CGM with 6 months of real-time glucose readings, giving you more convenience, confidence, and flexibility. So if you're one of those people who has that thought that I just did this, didn't I? Why do I have to do this again right now? If you don't like that feeling, give Eversense a try, Because with Eversense, you'll replace the sensor just once every 6 months via a simple in-office visit. EversenseCGM.com/juicebox to learn more and get started today. Would you like to take a break to take a shower? You can with Eversense without wasting a sensor. Don't want anybody to know for your big day? Take it off. No one has to know. Have your sensors been failing before 10 or 14 days? That won't happen with Eversense. Have you ever had a sensor get torn off while you're pulling off your shirt? That won't happen with Eversense. So no sensor to get knocked off. It's as discreet as you want it to be. It's incredibly accurate, and you only have to change it once every 6 months. EversenseCGM.com/juicebox.
Which could be, yeah.
Yeah, because I think the GLP hits the inflammation and impacts the
Resistance.
the hormonal issue, right? And you know, I know this is about PCOS, so we're going to go back to, you know, going through the three hallmarks of it. But if I ask, how does a GLP impact PCOS? It says GLP is an incretin hormone that plays a crucial role in glucose metabolism. Why can't I say the word? Why can't I say the words I can say? Metabolism, and has various effects on the body, which can impact PCOS in several ways. The ways are by reducing insulin sensitivity, weight management, hormonal regulation, and impacting inflammation. And I've told this like brief story on the podcast a number of times since, you know, GLPs have become more prevalent, but there is a Facebook group full of women who couldn't get pregnant their whole lives that went on GLP medications and were getting pregnant because they were so positive they were never going to have a baby that they didn't do any kind of birth control.
Yeah.
Right. So kind of to ping pong back to it, irregular menstrual periods, that's such a kind way to say what happens. You know what I mean?
Right.
Instead of saying irregular menstrual periods, shouldn't it say Mike Tyson hit me for 7 days and I bled a lot while it was happening? You know what I mean? Because that's, I think, what it feels like.
Mm-hmm.
Infrequent, irregular, or prolonged menstrual cycles are common. Great. Yeah. And then what happens then, too, is you end up with low iron, low ferritin, you know,
absolutely.
And there's a cascading issue.
Well, I think it highlights how much just one little thing can get off in the body. Let's say it is the hormone production that's incorrect coming from the ovaries, right? Mm-hmm. And you mentioned something before, androgen, right? Androgens they're kind of a kind of hormone that's usually a lot higher for men, but are found in smaller amounts in women. And so an imbalance of that creates an imbalance in the cycle, which then it's like, again, a ball at the top of a hill that you keep rolling and it just keeps gathering more, right? And it impacts everything then. Mm-hmm. And I think the problem is that there aren't enough specialists to this particular condition, much like really knowledgeable type 1 clinicians, right? And so you really have to find a specialist who can take the time to sit down. What have your symptoms been? How long have you navigated this? You know, I mean, the other typical things are, again, as I said, sort of body being often heavier, metabolic issues beyond, you know, diabetes or whatever, acne or really significant skin breakout problems.
Body hair. Right.
Body hair.
Facial hair.
From a woman's standpoint, should not be, and has a lot of relevance to that androgen management in the body. So the right clinician is going to sit down and take a note of all of these and say, okay, we've got more testing to do. We can test these hormones, blah, blah, blah. But as you said, it's typically just, well, you just have heavy periods and they're irregular and there's no way to make them more regular. Well, why don't we try birth control? Birth control is going to regulate it all for you. And it's like a Band-Aid.
Yeah.
Don't give me a Band-Aid.
I don't go down that road because first of all, I'm not a woman and I don't understand it enough to talk about it, the birth control piece, but I've heard a lot of women raise a red flag and say, look, birth control really screwed me up. So, you know, I guess the easy comparison is, you know, pharma companies figured out how to give men erections, but they can't seem to help women do these things. And this one falls heavy on me because I think my daughter's impacted by this. And, you know, And at the same time, no one's looking into it. And we took her to a good doctor. And even that doctor's like, I don't know how to help you with this. They just don't have any. But anyway, I'm not saying GLPs are not, they're not a cure-all. But I think that right. But I believe we're in the early days of understanding the things they are going to impact. I'm just started hearing conversations recently about how it might be helping people with arthritis. I don't even understand how that could be. But the inflammation piece, there's some people are using it for pain management. People live with pain for years. Like for my entire lifetime, people have been running around yelling, inflammation. We got to get rid of inflammation. And it doesn't seem crazy to me that inflammation has to be at one of the hearts of how you end up with type 1 diabetes. And that I see a lot of women with type 1 diabetes talking about PCOS. Like it seems like there's a connection.
Kind of what goes along with it is if you read anything, even in the simplest literature about inflammation, what's one of the biggest things that impacts it? Sugar.
Yeah. Then you're feeding it on top of it. Yeah.
You're feeding it, right? And then with PCOS, you have sort of a metabolic, poorly regulated glucose use, poorly regulated insulin sensitivity. And so you've got these changes in your blood sugar level that are just keeping inflammation high.
Yeah.
And until you learn how to navigate the inflammation, which will help the insulin resistance, again, it's a ball that once it gets rolling in the right direction with the right information and or the right treatments or plans, you can really make a very big difference.
I don't think you can really understand as a type 1 how screwed up it is that your body's not making insulin. Stick with me for a second until you look at a CGM on a person whose body is making it and watch that their blood sugars don't really rise very much at all. And then you realize that if you don't pre-bolus at the exact right time, your blood sugar is going to go from 85 to 150 in, 2 revolutions of your Dexcom. And
I think the other thing there too is watching when it does rise, how quickly the rise gets taken care of on the CGM of a person who doesn't have diabetes. Goes up and it's like clockwork. You can almost time it to the point of the beta cells knowing exactly what they're doing, how to time everything, how much needed to go out. Like that's the piece that we can't, as much as we have with intelligent systems now and putting the right information in, we cannot mimic what the body was meant to do on its own. And then the landing point, right? It controls that rise. You see it turn on a CGM and it's like a beautiful landing of a plane that you didn't think, you're like, this is going to crash, and it doesn't crash.
You have good insulin sensitivity. You're not type 1 and your blood sugar it doesn't get low. Like, and that is the point. Like insulin sensitivity is the way you think about it because you're type 1 is different. But what I'm talking about is like a person who doesn't have diabetes, it sees the need and it puts insulin in immediately. It quells the spike immediately and it shuts it off immediately. And, that stuff it's just not happening for type 1s and type 2s as well. But listen, I'm just going to go like GLP has an anti-inflammatory property. Chronic low-grade inflammation is often associated with PCOS and can worsen symptoms. By reducing inflammation, GLP can potentially alleviate some PCOS symptoms. So a GLP medication's not the cure for PCOS, but it is it's going to impact inflammation, hopefully. Also, by improving insulin sensitivity and reducing hyperinsulinemia, high insulin level. Did I do it? GLP can help in lowering androgen levels. High levels of insulin can lead to an increase in androgen production, which is responsible for symptoms such as hirsutism, which means hairy, and acne in PCOS. If GLP impacts weight management, it does it by slowing gastric emptying, increases your satiety, and reduces appetite, which can lead to weight loss. Weight management is a key component in managing PCOS symptoms because obesity can exacerbate insulin resistance and other symptoms of PCOS. And then, of course, GLP-1 enhances insulin secretion in response to food intake and improves insulin sensitivity. Since insulin resistance is common in PCOS, GLP-1 could help in managing blood glucose levels more effectively. I think that's for a person who doesn't have type 1.
And it's also kind of the hallmark reason, the resistance piece of that whole PCOS is a reason that the main medication that's long-term been prescribed for it is metformin.
Metformin, right.
Yeah. I mean, that's been used for years and years and years and has gained footage in even type 1 and type 1 with PCOS. But I think it's a baseline. For some people, it does a really great job. For other people, they may need something more impactful, something like a GLP-1, which again is your body doesn't technically make metformin. Your body actually does make a GLP, right? It is something that is secreted in the body. It's just not happening the right way in some people.
Yeah. And I think we're done here, but I'm going to end with, in case someone's listening from Lilly or Novo or any of the other companies who are going to come along, and they're all going to come along, you got to look at these other things that GLPs are helping with and find different dosing strategies for people who are being helped for other things. Because like I've shared with Jenny privately, like it's helping my daughter with so many issues, but it's quelling her
appetite too much.
Yeah. She needs less of the medication, and they come pre-dosed. So,
it's a one pop. That's actually, as another side note to these companies, there are many people who really hate the way that it is dosed in the one. It's like a spring-loaded, like pop it in kind of dose. And I can tell you that there are a lot of people that don't like that.
Here's mine for later.
So there you go.
Yeah, that I take for just weight management. There are times I pick the right spot and I'm like, oh, a little pressure. That's not bad. It's over. And there are some times that after I do it, I go, God damn. It's like, because it feels like, sometimes it can feel like you got shot.
Yeah.
Listen, I know what they're doing. I understand why it's happening the way it's happening. It's money. But
of course.
Yeah. But let's get to the point where we're realizing I'm tired of it just being, doctors on YouTube going, hey, I'm using this now for my patients for this and this and this and this. Like, let them, because you're not fooling anybody.
No.
I'm going to tell you that the YouTube is full of videos with hundreds of thousands of views about how to take the medication out of this and microdose it. So why don't you just make it safe for people, for God's sakes? Okay, that was it. I didn't know how that happened. I didn't realize that was going to happen. Sorry.
That's all right. Little side note.
I didn't know I was going to get bitchy at the end, but there you go.
PCOS and a note to,
and a note to pharma. Like, why don't you
there you go.
Make something that'll help people with more than just the diabetes and the weight loss. Yeah, give people options. How hard is that, really?
Right.
I want to thank the Eversense CGM for sponsoring this episode of the Juicebox Podcast and invite you to go to eversensecgm.com/juicebox to learn more about this terrific device. You can head over now and just absorb everything that the website has to offer, and that way you'll know if Eversense feels right for you. eversensecgm.com/juicebox. A huge thank you to one of today's sponsors, Gvoke Glucagon. Find out more about Gvoke HypoPen at gvokeglucagon.com/juicebox. You spell that GVOKEGLUCAGON.com/juicebox. A diabetes diagnosis comes with a lot of new terms, and you're not going to understand most of them. That's why we made Defining Diabetes. Go to juiceboxpodcast.com, up into the menu, and click on Defining Diabetes to find the series that will tell you what all of those words mean. Short, fun, and informative, that's Defining Diabetes. Lots of people with autoimmune seem to have trouble with their thyroid, and that's why I've made the Defining Thyroid series. Juiceboxpodcast.com, click on Defining Thyroid in the menu to find out more. If you're looking for community around type 1 diabetes, check out the Juicebox Podcast private Facebook group, Juicebox Podcast, Type 1 Diabetes. But everybody is welcome. Type 1, Type 2, gestational, loved ones, it doesn't matter to me. If you're impacted by diabetes and you're looking for support, comfort, or community, check out Juicebox Podcast, Type 1 Diabetes on Facebook. Hey, thanks for listening all the way to the end. I really appreciate your loyalty and listenership. Thank you so much for listening. I'll be back very soon with another episode of the Juicebox Podcast. The episode you just heard was professionally edited by Wrong Way Recording. wrongwayrecording.com.